the recovery from surgery. So you will recover fairly quickly after surgery, having spent a day or two in hospital. Each day should just get better and better and better. I tell my patients when they leave hospital, if you take a step back at any time in the first really 30 days, you really must get in touch. But otherwise, most people just every day is better and better and better. And when you have your 6-week catch up with your surgeon or nurse, things have really settled down for you. But beyond that, the next 6 months really is the honeymoon period. You will lose most of your weight in those first 6 months. And then it slows down. Everyone has a panic and says, gosh, it stopped, but it hasn't. It's just slowed right down. And and you'll lose weight at a slower rate for really up to 2 years, sometimes longer, sometimes shorter. So the thing to remember is that it's a tool, and the more you put into it, the better you will do. I tell my patients there's 3 facets to weight loss. 1 is portion size, 2 is choice, and 3 is exercise. The more you do of each of those 3, the more successful you'll be. Now, I understand that not every patient can exercise. Some of my patients are bedbound, and so it means you have to work harder with the other 2 aspects. But anything you can do in terms of physical exercise will be beneficial. So, portion size is easy because your surgeon will make your stomach smaller. So whether you like it or not, your portions are going to get small. But in the long term, patients sometimes worry about, will I stretch my pouch? I'll talk about that separately. Choice. So the other thing you will notice is the hunger hormone effect of surgery. So there's lots of popularity with these weight loss injections. And they essentially cause appetite suppression. And what they do is actually mimic the effects of surgery. So they cause a suppression of appetite and change in your taste perception. So you may go off certain foods. Now the good news is you tend to go off the bad stuff, but equally your palate will change. You may go off your favourite food. But the changes that you make are generally very positive. For example, when I go into Sainsbury's or any other supermarket and I can smell that freshly baked bread, my hunger hormones kick in, and it makes me want to go and buy more food. Now that may not work on you afterwards. You may go in the opposite direction. You might think that freshly baked bread just does not appeal anymore. Similarly, when you walk past a fried chicken shop or a kebab shop, where the smell makes you want to go in, it may not work on you after surgery, and you may actually find those smells really quite repulsive, comparable to sort of the changes that ladies feel when they're pregnant. Certain smells will really not appeal, and you may have similar experiences after surgery. You may become a hopeless cook if you like cooking, so your palate will change, your taste buds will change. You may not be able to match your dishes well, and if you're a foodie or like to wine taste or whiskey taste or whatever taste, your taste may be entirely different. But it's not all bad news. I mean, when you go out for dinner with your family and friends, they'll all be ordering extravagant, rich dishes, and you may just look at them and think it doesn't appeal anymore. And that's one of the secrets of bariatric surgery, in that taking your appetite away really, really does help you to make better food choices. But if you work as a chef, then I've warned you now, you may not be so good afterwards.